Hello, everybody, and welcome to the Lupus LA Your Story, Our Fight podcast, sponsored by our good friends at GSK. Today, we're talking about teeth, but we're talking about lupus and teeth and a person that is really going to make you smile. I want you all to meet Yvette Carrillo. She is a periodontist and an implant surgeon, which sounds incredibly painful. And I just got those, the chills when I was saying that because it's my worst nightmare. But and a lupus patient diagnosed in 2018, so relatively recently. And she's become a real advocate for lupus patients, and we're happy to have her on the podcast. Welcome, Yvette.
Thank you. And thanks for having me. And hello to everyone that's watching or listening.
So tell me about we talked before, and I know you really got your diagnosis at a very sort of critical time in your educational path.
Yeah, I did. So I did dental school at Loma Linda. So it's a school here in Southern California. And then I grew up in a small town. So I didn't really even know that there was specialties or that I could specialize after dental school. I thought once you're a dentist, you're done. And so I really found a passion in periodontics. And so I really liked Loma Linda. It's a Christian school. It's a faith-based school. So I really enjoyed going to school there. So I had an opportunity presented when someone dropped out of the residency program and the faculty knew I had an interest and an inkling. And so long story short, I got in on super short notice. They were like, you want to start in 2 weeks? And so I just saw it, as an opportunity to change my life. And so I jumped and I started the program quickly after. And I was walking to clinic 2 weeks after I started the residency that I didn't even know I was going to do. And I was on a crosswalk and I was struck by an SUV. So I was in a pedestrian versus vehicle accident. And so I was dealing with all these other issues from the car accident and trying to heal, plus dealing with residency. And I was doubling up on classes because I was trying to make up for the time that I missed when I was in the hospital for 2 months. And so I was really taking on a lot. Plus, I was taking on all these leadership roles and positions and really doing probably too much. So I was tired, but of course I was tired because I had too much on my plate. But then I started getting all these weird symptoms. And so I knew it couldn't have all been related to the accident. So that's when I kind of started to go on the journey of figuring out what was wrong. Initially, I thought I had MS because, of course, Dr. Google tells us everything, but I started making a list of all the symptoms that I was having that didn't fit within that the car accident trauma.
And you had a really important doctor who helped you figure it out, right?
Yeah, so I got through residency. I still had no diagnosis. I had a very nice pain management doctor who was really advocating for me at Loma Linda. But of course, like many of the lupus patients, I was told to stay off the internet and that I was researching too much. And so I kind of got that, not the like you're crazy thing, but they were basically just like, relax. And I'm thinking, no, something's wrong. So I finished residency. I moved back home to my small hometown, and my primary care doctor, he spent about 4 hours with just that initial appointment and following up and really listening to everything that I had to say. And so we went through different labs. And at the very end, he asked, is there anything else? And I said, can you check my ANA? I feel like it's autoimmune. So he did. And then he's really the one that catapulted the diagnosis with that. But he spent a lot of time with me and listening to how I was feeling, which was very important.
Yeah, I mean, I think that's a message we need to send to all doctors, because I would suspect having such a difficult car accident gives every doctor kind of it's because of this. And, to see the forest through the trees and realize that it's not from that, it takes time, and you really do have to listen to all of those symptoms.
Yeah. And I think just so many doctors were afraid to touch me after the accident because I had 4 brain hemorrhages, my lungs collapsed, my spleen had ruptured, my liver was damaged. So people were terrified once they would get that initial, the report. They were just kind of like, no one knew what to do. So yeah, it was really important to have some doctors on my side and really listen and say, hey, something's wrong, something else is going on here.
I think it's amazing that you even went back to residency with
Yeah.
all of that, let alone actually finished and started a practice, which is, it's really a testament to you. You must be. Were you always as a child? Were you really strong-willed and determined?
Yeah. It's always been a combination of being very, very determined, but then also something was in the background. I went home to visit my parents, and my senior year of high school, our yearbook, I found it in my room, and it was like a dictionary edition. And so our parents sent in the childhood pictures, and my mom's definition of me was achiever. So I'm like, oh my gosh, like a typical mom. She's like, hey, you're going to do this, you're going to achieve all these things. And then my definition that I gave myself, I put sleepy. And then the description, I said, I'm always tired. So I
Interesting.
think I've had this, the two sides to me where on one end, I'm very driven. I'm very type A. I won't let anything stop me. But then on the other side, I have this autoimmune disease where sometimes I just can't even get out of bed or do anything.
Were you, when you look back after your lupus diagnosis, pre-car accident, pre all of that, do you attribute, other than being tired, were there other symptoms that you look back on and say, oh yeah, that now it makes sense?
It was mostly fatigue for me because the joint aches that didn't start until later. I was getting some neuropathy, and that didn't start until later. But the fatigue is my main symptom, and that, I think, looking back, I've always been fatigued. Or I had a lot of GI issues. I was thinking back the other day, and my mom kind of used to joke that in Spanish, dolor is pain. And she said, I should have named you Dolores because you're always complaining about something. So even as a kid, I was just like, hey, this hurts, or hey, this is hurting, and just kind of, yeah, complaining about something. So I think mostly fatigue, but other small things that I couldn't really pinpoint.
And do you still have issues, I guess, with certain doctors and your autoimmune symptoms being confused with still remnants of the car accident, or has that really been solved and now you've got real tight focus on the autoimmune issues?
I think most of the symptoms from the car accident are under control, I guess. Obviously, a little bit of PTSD and anxiety from dealing with that trauma, which can definitely cross over into lupus and, feeling that anxiety or depression when we can't get a hold of the symptoms. So there is some crossover there.
Mm-hmm. When you talked about your schooling, you talked about faith, and I wonder if you could talk a little bit about how faith has played a part in your, not so much your diagnosis, but in the way you handle your lupus.
Yeah, it's been such a big part of the healing component. I grew up in a Christian home, so I've always believed in God or the universe, some type of higher power. And being in that car accident and the near fatal accident, I always get the what is it, like a near death experience. So I didn't have that, but I just feel like my journey wasn't done. I wasn't needed in a other place. I was needed here for now. So yeah, I think it definitely helped. I don't know that I could have gotten through even the recovery. The hospital's right next to the dental school and the clinic, and I had so many faculty and students and new friends and old friends that played such a big role in just visiting and letting me know that they cared and they were supporting me. So I don't know that I would have gotten that at a different school or institution. So I think faith is a huge part of my healing process.
I like that. I mean, I think it's faith and friendships, it's that higher power, and then also what's right in front of you, and what's tangible and what can help get you through that. I mean, has that carried over in through the autoimmune diagnosis?
Yeah, it's just kind of, for me, I look at it as like a self-check or a reminder, because I'm a yes person. I'm always going to say yes. I'm always going to say, yeah, I can do that. Yeah, I can help with this. Yeah, I can be on that committee.
That's why you're on the podcast right now, right?
No, I love it.
You wouldn't say no.
spreading awareness. So just because you can do something doesn't mean you should. And if I take on too many things, I'll flare because I'm stressed. So I think for me, it's a blessing, and it's God's way of saying, like, hey, slow down a little bit. Like, are you maybe saying yes to too many things? Like, let's bring it back a little bit.
So in terms of advocacy, what led you to take that? I mean, it's all part of the same personality and drive. But how has that been for you?
So when I finally got diagnosed with lupus, then I started, what do we all do? I went on YouTube and I was like, okay, let's see who's talking about this. How do other people feel? Because at the time I didn't know anybody that had lupus. And so I got online and there was nobody. And I thought, okay, maybe blogs. And I found a couple of blogs. And so then I had that moment of thinking, am I going to hide this? And I'm not going to tell people that something's wrong, or am I going to be open about this and share what I'm going through? And I decided to be open and share and be an advocate for lupus patients. And then I feel like more people, more friends started coming forward or sharing with me in private that they also had some type of autoimmune disease. So it's another community, I guess, in that friendship and feeling like you have someone and you're not alone.
I always say that when people are on the fence about talking about a lupus diagnosis or any kind of autoimmune diagnosis, I always say you'll be amazed when you start talking about it, how many people have an autoimmune connection. I mean, it's so prevalent, unfortunately, but it does really open you up to lots of interesting relationships and support systems and things like that. So we're going to come right back. We're going to talk teeth. I promised you that at the beginning. We're going to do it, but we're going to take a little break and hear from the folks at Lupus LA.
Lupus LA keeps patients informed by having 3 annual Latest on Lupus patient conferences each year. Our annual patient conferences feature the best and brightest speakers in the field of lupus research and care. Visit our website at lupusla.org.
We're back on the Your Story, Our Fight podcast with Yvette Carrillo, our periodontist and implant surgeon and lupus patient. So first, I think we should start out. Let's tell everybody what periodontists do and how they're different from dentists.
Okay, so I joke that I went all through dental school to never really touch teeth again. So my specialty, it's kind of true. My specialty is a surgical specialty. So usually if you're seeing me, it's because you need either a gum graft or a bone graft or a dental implant or something along those lines, or because you either have cancer, you've gone through chemo and radiation, or you're a patient that has some type of autoimmune disease and you need more than what a general dentist can provide for you. So for periodontal disease, I tell patients it's not quite an autoimmune disease, but it kind of acts like one. It's where, say, for whatever reasons, whether financial or emotional, if you haven't seen a dentist in a long time, that plaque and tartar, which is a combination, mostly bacteria. There's a little bit of virus in there. There's a little bit of fungus, but all that plaque and bacteria and food, it just dies and it builds up on your teeth, and your body senses that something's there, some type of invader. And so it starts releasing all those inflammatory cells that we know as autoimmune disease patients, because we get like the C-reactive protein measured to see if we're flaring or not flaring. So it's the same inflammatory markers or similar ones in periodontal disease, because your body senses that something's there. So it releases all those warrior cells, and you start to lose bone, you start to lose gum tissue, your gums flare, you get a lot of bleeding because there's a lot of inflammation. And so that's my specialty. I try to control the gum disease, and there's links between gum disease or perio disease and diabetes, rheumatoid arthritis, heart disease. So it's that whole systemic, whole body link. And so I'm super passionate about that, not just because I'm a lupus patient, but I just find it so fascinating.
I think it's also interesting that you ended up picking a specialty that also really does relate to the autoimmune world before you knew you had an autoimmune disease.
Right. So something was there, something was brewing, maybe subconsciously, because I really struggled in dental school. I wasn't an A student. Clinically, I did well. With patients, I did well, but taking tests for me was so hard. But for perio, when those exams came up, it made sense. Something clicked. So maybe there was some subconscious there going on.
So, not to give too much away about my own teeth, but I'm very self-conscious now as I'm recording this. Thankfully, most of you are going to listen and not look. But I've been taking prednisone for a long, long time. And so I see a periodontist to get my teeth cleaned because more often because of the deterioration. Do you see a lot of that from medicines that autoimmune patients take? Not necessarily an autoimmune reaction in the teeth, but medicine related.
Oh yeah, definitely. All those medications, whether it's the medication itself or just the amount and the number of medications that patients are taking, it can cause dry mouth. They can cause the methotrexate. So just the medications themselves, even though it's kind of helping us in one way, but it can definitely have that dental implication as well.
So what do you recommend for the average lupus patient or autoimmune patient? What do you recommend they do differently about their dental health versus, the average person that doesn't have an autoimmune condition?
So definitely seeing a periodontist and being under their care, as well as your general dentist, is important. I tell patients, think about it like on the medical side. You have a primary care doctor and they're kind of like your quarterback. So that would be the general dentist. They would do your crowns, your fillings. They're kind of your quarterback on your team, but you still need to be under the care of a periodontist, especially when you have flare-ups and stress. You can see that your gums are so telling. They tell me everything. I can tell when you're smoking, if you're maybe drinking a little bit too much. Your gums are very, very telling. So seeing a periodontist and then getting your cleanings more regular, because we aren't like your normal patient. Our bodies are very sensitive to stress, to medications, to tartar. Our body's just ready to fight anyone and anything, including ourselves. So seeing your dentist more regularly and your dental hygienist, because the cleanings are so important. Getting that plaque, and even the bacteria themselves, they release their own toxic elements. So making sure that we're keeping everything as clean as possible.
I highly recommend checking out Yvette's Instagram page if you want to see some really gnarly pictures of what she does. Your Instagram page is like this really cool mix of like this, bright smiling woman and then crazy horrible tooth pictures. But I think it was. What's your Instagram handle? I don't have it written.
Perio.princess. The Perio Princess.
So which is a perfect. It's really, I don't know how you picked it, but it's perfect for that. It makes total sense now.
My students, they kind of helped me come up with the name years ago when I started Instagramming.
So now that brings me to my next question. What are you doing now? Talk about, I know you practice, you teach, tell me kind of what's the whole picture. What's a typical week look like for you?
So it's kind of a combination. I'll teach a little bit, maybe like 1 day a week, and then private practice for the most part, and then a little bit of lecture sometimes. So I like to keep everything busy. I'm also on the Dental Society here in San Diego, so doing either in-person meeting now or Zoom meetings, but kind of like my personal life and my professional life, I like to do a little bit of everything to kind of, keep my mind busy.
And so do you now specialize at all in treating autoimmune patients, or have they found their way to you, given that has your advocacy in some way been an advertisement?
I don't know that I'm because with specialists, it's a lot of the general dentists are referring to me, but probably some type of like vibe or energy that I'm putting out. I do see a lot of autoimmune patients, or I'll note that they have some type of autoimmune disease. So I get really, really neat patients, because not just lupus, but like Crohn's disease, it manifests in the mouth. And I love taking pictures of my patients and then posting it on Instagram. It's been a great way to, spread awareness, and just for doctors and patients to keep an eye out and look out for patients. So I don't know if it's because I'm directly looking, or I'm just maybe paying a little bit more attention to it, but I do see a lot of autoimmune disease patients, and then a few cancer patients as well.
I know you have a Hispanic background, and I know that's one of the challenges we always face at Lupus LA is really working hard to, that population is so underserved in so many ways, and it's such a huge part of the lupus community. Has that been something that you've been able to focus on at all?
Yeah, I've been able to find a nice Hispanic community as well, because I noticed that with just healthcare in general, even perio disease affects the Hispanic population different than it does other populations. So it's been an interesting onion with lots of layers to peel back. So it's been nice, because I feel, just as a culture, and I hate to generalize, but I think sometimes we can be mistrustful of doctors because there's either language and communication barriers or financial barriers. So there's so many barriers to get to that doctor. And then, as we know, it's so hard to actually get that lupus diagnosis. And so sometimes we can be mistrustful of doctors. And so there's been so many layers to peel back with the Hispanic community, with lupus. And I think just culturally too, going back to my mom, or when, she said that she should have named me Dolores because I was always complaining. Just as a culture, at least in my family, it was like, no complaining, you keep your head down, get good grades, you work hard. So in some ways, just with my family background and my history, it's like, it was a luxury to be in the United States, first of all. And so I couldn't take any opportunities for granted. I couldn't, complain, quote unquote, complain, or say I had this pain, I had this issue. So I think that's part of it too, just being mistrustful a little bit of healthcare. And then, there's so many layers to that, I think, with the Hispanic population. So speaking Spanish as providers and finding a provider that you're comfortable with is so important also. Finding a doctor that you get along with, finding a doctor that listens to you. And, I think as a Hispanic provider and as a Latina woman, it's really important for me to have a voice and to have a say. And because I can speak Spanish and I can speak English, so sometimes you need somebody like that to bridge that gap.
So given all that you do, how do you manage your autoimmune flares or not flare? How do you make sure that you don't take on too much? I know you said you're a yes person, but have you had to, since you're only diagnosed in 2018, have you really had to kind of adjust your mindset?
Yeah, it's so hard. I'm sure a lot of us feel this way, but it's like your mind is living in this excel. And sometimes you want to do all these things and you have all these ideas, and just listening to other people that have been on the podcast. A lot of us are creatives and we like to do certain things. And so it's been really, really tough for me to tone it back a little bit, because for me, I notice that I get flares by stress. So if I'm taking on too much and then being out in the sun, which I live in California, so of course it's hard to avoid the sun, but thankfully San Diego has a good marine layer, so it's not too bad. But yeah, learning, I was told by a mentor that it's a very, very powerful thing to learn when to say no. And so I really have to, because just because we can do something doesn't mean we should. So I've really had to evaluate when an opportunity comes, like, is this the right fit? Is now the right timing? Is this something I can do? Because I have the tendency to, if I say no to something, that just means I'm going to make space for something else to say yes to. So it's been really tough, because ultimately what I want to do and what I love doing is surgery. I love doing surgery. I love being with my patients. I love working. And if I don't take care of myself, if I'm not eating healthy, if I'm not really focusing on all those things, then I can't work and I can't do surgery and I can't do a good job. And it's not my patient's fault. Not that it's anyone's fault, but
Yeah.
Yeah.
I hear that. Have you been able to, I know a lot of lupus patients or autoimmune patients get diagnosed by doctors that are not their primary care or even a rheumatologist. Has that been something that you're more on the lookout for in terms of, have you ever said to a patient, hey, look, I think you might want to get this checked out?
Yeah. So my dad is actually a dentist also, and he's been practicing for 40 years and he's in New Mexico. And so just as a state, it's really underserved. There's not a lot of specialists. There's a couple of rheumatologists. So they're really, really lacking in dental healthcare. There's like 8 periodontists in the whole state, versus San Diego, there's 55 of us just in the city. So they're really underserved. And so I was going once a month to my dad's office and I was seeing his patients. And he has a couple of offices, and one was in a remote town. So there I was really, really seeing quite a bit of patients that were either retired or they went to this tiny little mountain town. Mostly retired patients. And so a lot of the times I found myself in this weird gray area of, am I saying too much? Am I crossing into the medical territory? But I'm the type of provider that if I see something, I'm going to say something. So I had one patient where you could clearly see that she had a malar rash. And so I asked her, I noticed she didn't have any autoimmune disease marked on her health history sheet. And so I asked her and she said no. And so I asked her, are you tired? And just a few questions. And her husband was there kind of looking at her like, I've been telling you something's wrong. I said, hey, listen, I'm not a physician. I'm not a medical doctor, but you should go get this checked. And so I recommended a doctor that she go see. Or even in lupus, there's mouth ulcers and certain lesions that you can see in the mouth. And so I did find myself a few times, if the patient wasn't already diagnosed, just recommending that they go check it out, because it might not be, everybody presents differently. Some people it's fatigue, some people it's a mouth sores, some people it's a butterfly rash. So, just making sure that if they didn't notice, or I think just even from a patient and doctor standpoint, it's hard to relay to your doctors how you feel, So
listen,
yeah.
I think it all comes, your story is sort of the perfect full circle. It's from diagnosis to, to your pre-symptoms, to your diagnosis, to your continuing your education, to now being an advocate and another set of eyeballs in the fight to diagnose autoimmune disease. Because I think so many people go so many years without a real diagnosis, and it really is an all hands on deck. You hear dermatologists and primary care doctors and my dentist, by the way, here talk about full circle, also has lupus.
Wow.
Totally coincidentally, when I walked in and he saw my health history, we had that in common. So, I think that there should be a real symbiotic relationship between the entire medical field to look for these autoimmune diseases because they're so prevalent. And, I appreciate the work you're doing. I appreciate the advocacy you're doing. And I never want to have to go into your office, but I'll be happy to follow you on Instagram and keep our communication going. And everybody should go check out the Perio Princess, Yvette Carrillo. Thank you so much for being with us on the podcast today.
Thank you for having me. I really appreciate it. And I mean, maybe stop by my office, but you don't have to be, hopefully you don't have to be my patient.
I'll wave with keeping my mouth closed, but I really appreciate you joining us. And,
Thank you so much.
Good luck to you.
Thank you.
On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.